Okay, good morning everyone. Today I'll be teaching you how to perform the most simple test, malaria tests. So what you need for this particular test, you need your malaria strip. This is a malaria strip. This is your sample. I'm not going to show the name. Then this is the buffer, the malaria buffer, as you can see. So you start. This is your strip. Making sure that you're on your gloves because you have to maintain, make sure that everything is all right. So this is what I'll be using. Ignore the calibration. You can use as little as 10 microliter to do this. Let's just go with 12 so we can actually pick something. So this is the sample. Again, you mix it well. You have to mix it very well. Then you open. Then you pick just a little drop. Insert there. You can actually use a pipette, smaller pipette, pasture pipette, can still get the job done. Then you get your buffer. Now watch where I inserted the sample at the sample spots. This is something that a lot of people miss. They don't know where to insert. You insert at the sample zone, and then this is your buffer. You're going to put it in the buffer zone. 2 drops will do the job. So 1, 2, and then you allow it to read for 5 minutes. So this is your strip. You have to discard everything. You have to maintain a sanitary condition. So now we're reading our results, and then we'll come back and check the results in 5 minutes. I want you to notice something. Watch how the sample is migrating. Let me bring it down so you can actually observe it. So you can see how the sample is migrating. That shows the buffer actually did the job. There was enough buffer to migrate the sample. So watch how it's migrating. Are you seeing it? So you might be wondering which company should you get. I would suggest you get the global because it's always very best because it gives its results even when other strip methods are proving difficult to type down diagnosis. Remember, it's a rapid field technique, so it's not really something you bank on because sometimes the person can have symptoms but it's still not reading on the strip, and that's why at the end of the day it's still very necessary that you know how to do the basic microscopy. So for now, you can see there's already a line, first line at the control. That shows that what you did is correct. Always know that in every test you're doing, if this first line is not showing, you're not doing it right. So the first line has to show to tell you that what you did is right. So in this case, it's showing already that what you did is right. So you have to now wait the additional 3 minutes for the results to read, and then we can come back to it. Okay, as you can see, it's done reading. It's very much done. So you can see that there's just one line showing that it's negative. That's the one line. So assuming there are 2 lines, it's positive. So one line here shows that it's negative. That means the patient doesn't have malaria. It's as simple as that. All thanks to technology, we can now easily diagnose malaria from our sitting rooms without necessarily having to go to the hospital. All you need is to get the global tech. I'm not even advertising for them, but get a very reliable company that you can trust. Then at the same time, get your sample. You can actually use a needle prick. This one happens to be the sample was in the container. You can use a needle prick and put the blood from your prick here directly here, and then you can add the buffer. So the buffer always comes with the different malaria strips, so you don't have to worry about do I buy buffer different. No, it always comes inside it. And there you have it. Bye.